Kate is a senior director at the Institute for Healthcare Improvement, where she has worked since 2007. And she is a lead for the Conversation Project, which is why we know her. But she also manages and cultivates relationships with national and state level organizations that engage the general public in advanced care planning. So we've worked with Kate for many years. She actually was able to come out to Hawaii in 2017 when we did a series of presentations about the fabulous materials the Conversation Project has to offer. We are, I think, still super users of the materials. And Kate also, her grandmother used to live in Kailua, so she has family memories of the house in Kailua and spending time here with us. So Kate, thank you so much for waiting till after dark and spending time with us. So thank you and welcome.
Thank you. It is lovely to be with you. I remember the 2017 trip fondly, and all the years before that for family. As Jeanette was saying, grandparents were in Kailua for about 40 years. My dad and all his siblings grew up there. So I'm coming with a slightly different hat on today, without my super formal advanced care planning hat on, but to share a little bit more about work that I'm doing with the age-friendly health system movement at IHI and another consumer tool that we have created for older adults. Okay. And then, as Jeanette said, feel free to pop anything into the chat, kind of ideas, questions, thoughts. You guys are the experts on Hawaii and the people that you serve and how you think this might work, or the kind of questions that you have. And I'm just going to introduce you a little bit to it. So to start, a little bit in case you are not familiar with the Institute for Healthcare Improvement and the Age-Friendly Health System movement. This is a initiative sponsored by the John A. Hartford Foundation. We also work with the American Hospital Association and Catholic Health Association in the United States. And it is a movement around kind of an evidence base of care to improve care throughout the whole US, although now some other countries are adding it for older adults. And it's really focused on these three, they really all go together, these 4 M's. The first is about focusing on what matters to somebody. That should always be like the keys to the kingdom, everybody should be focused on. Medications, mentation, which is around depression, delirium, dementia, and then mobility. So there's a lot of work that IHI and other organizations do around these 4 M's. You'll see that coming up a lot. There's over 5,000 care sites that are part of this, or close to about 5 million older adults who've been reached with this. And it's everything from small critical access hospitals and rural settings to CVS minute clinics to really large academic medical centers, home health, nursing homes. We're kind of working with all different groups. And we're pretty close with the geriatric surgery verification program, or geriatric EDs, or a lot of the groups that are realizing, a lot of states are realizing that this is an important thing to be paying attention to. And while there's a lot of work going on to help health systems, there's also work going on in this kind of macro environment. How do we work with EHR vendors to be sure that these 4 M's are accounted for, that people can tell what's going on? Just had a call last week with some Medicare Advantage plans that are trying to incorporate and think about what does it mean to be age-friendly as an MA plan. We've worked really closely with folks at CMS. There's now an attestation measure in 2025 that a lot of health systems are working on to acknowledge each of these 4 M's. So there's a lot of work going on to be sure that it's not just something that hospitals have to do on their own, but the kind of ecosystem around them is in service of that as well. And one of the things that we've heard over the last few years is, and I'm sure this is of no surprise to you, that what brings staff the greatest satisfaction in their jobs is being able to deliver that ideal patient experience, that adults, they want that collaboration and kindness. And I love this statistic from the John A. Hartford Foundation on the right, that 99% of adults over 50 say that in the event of a serious illness, they want what matters to be the center of everything. And so we were hearing from different health systems, we would like to have a tool to help older adults get kind of prepared for their appointments. And we were hearing from older adults, these 4 M's sound really neat, but how can we get involved with it? So a lot of it kind of comes down to this idea around shared decision-making And you may not be too surprised at this idea of kind of care was over in one extreme where it used to be, clinicians will decide everything. Let's knock her out while delivering a baby. She doesn't need to know she's got breast cancer. Dad, you can sit out in the waiting room. We'll tell you what's going on. Kind of in all levels of care, clinicians kind of got to decide what was going on. Then kind of swung a little bit far to the right where everything was kind of put back on patient. Well, what do you think? Well, what do you want? Without as much clinician input. And really trying to come to the center, that we understand from the patient or from family caregivers what matters most to them. The clinicians can kind of offer their recommendations and discussion, and we can make informed decisions together. So we know that that really starts with communication, two-way conversations, and that's what my health checklist was meant to foster. It's kind of a tool for older adults to be equally as involved with kind of sharing what matters to them. And as I mentioned, we got requests from health systems too, who were doing a lot to train their staff on this, but the concept of the 4Ms was a little bit new to the public. And so if any of you are familiar with the conversation starter guides, it looks fairly similar as a concept. I'm holding up a hard copy. And I'm going to share a little bit more about it with you. What I want to give you a heads up on is there's a slightly new version in about 2 weeks that's going to be coming up. So I'm showing you this version. It's like a few examples have changed, and I'll call that out when we come to it. But I also just want to cover what this tool is and isn't and kind of the purpose. So it's meant to be a guide designed to help older adults reflect on their health and well-being and kind of assessing all aspects of health centered on the 4Ms. It is not meant to be a tool to be filled out during an appointment time or to take the place of any intake forms or questionnaires that you may already have. It's really a workbook for at-home self-reflection to feel prepared. You can review it at home on your own time. It might be with a family caregiver. It can help people so they don't walk out of an appointment and be like, oh, I forgot to mention this thing that I thought about a couple months ago. And we are being open with what the definition of an older adult may be. I personally think that this tool works for anybody over 18. I think it's just a good way of thinking holistically about our care. Our funder happens to be focused only on older adults. We've talked to different health systems who say, I remember working at Temple University Health System in Philadelphia, who said our average life expectancy is 20 years shorter than 2 zip codes over. Our people experience aging and weathering at a much younger age. So we're not going off of an age, but kind of where people are in their health. And so I leave that open to interpretation for you. There's nothing in it that is meant to, we want anybody to see themselves reflected in it. So on the What Matters page, you can see there's kind of like a spread on each set of this. Across all 4Ms, we give some open-ended prompting questions to help people think about their situation now, what's going well, what could be better, and what might you want your provider to know, questions or concerns. And then for each prompt, we give examples, kind of some ideas under boxes to get someone's thinking started. And we very carefully crafted with feedback from older adults, from caregivers, from healthcare team members. Some healthcare team members are older adults or they are caregivers. There's a lot of people who are kind of in this space that really share a range of life experiences. So whether somebody's retired or not, various income levels, housing needs, different physical abilities, able-bodied, people who are frail, we think that anybody could see themselves reflected in some of the questions or the images used. And we start and ground with what matters and then have a similar spread for each of the Ms. The next one's around medications, supports kind of important tasks like tracking medications, but goes beyond just prescriptions, kind of prompting for over-the-counter medications, herbal remedies, talks about concerns on cost or trouble keeping track of what to take. I was telling you the 4Ms before, and there was mentation, which feels kind of like a made-up word, and we don't tend to use it out in the public. That works in the health setting, but we use mind if we're reaching out to the public. This is kind of that mentation thing, and it has prompts to get people to reflect on potential depression or memory loss, as well as depression, anxiety, loneliness. And one of the changes to this is we are going to add a little information around delirium to help people understand what they might be looking for and to be aware of. Those 3 Ds of depression, dementia, delirium are what the health systems are really focused on. And then the next one here is mobility, which is both moving around in the home and outside, kind of going from place to place. And then on the last page, we have kind of the checklist where we suggest people pull it all together, bring up the top 1 to 3 things that you really want to bring to an appointment. We recognize the time constraints that care team members all have. We're not going to go through every one of the boxes, but what are the things that and people may not want to fill out every single page. That's okay. But reviewing it can kind of help prompt people think about what they want to bring. And we want, again, anybody to pick it up and think it's for them. Throughout the guide, we try to address issues that might feel embarrassing, but maybe once you see it offered, it gives permission to go there. So talking about loneliness, things costing too much, bladder control, relationships and intimacy. We wanted to use no gendered language or assumptions about family relationships or sexual orientation, and include language and imagery that would be reflective of as many life experiences as possible. And just as background, we co-designed this guide with older adults and those supporting and caring for older adults and experts in the age-friendly space. We started the process kind of initially getting ideas. We went through at least about 10 drafts of the guide, getting feedback from people, got it fully mocked up, and then brought it to focus groups that were facilitated by somebody else of older adults and caregivers in low and middle income settings, a separate one for older adults, a separate one for caregivers. And got really great feedback from people on how to make things a little bit better. How can I get this? I actually want copies of that right now. And so we feel pretty excited about that. We have it in Chinese, Spanish, Portuguese, and English. And the new guide, the feedback that we've had, this has now been out in the field for about a year. And some advice that we've gotten was to address some things around if there's a recent death in your life. When you talk about depression, how much of this is kind of a medical issue versus a major loss or grief has gone on in your world. A little more emphasis on caregiving roles that may happen. Sometimes the older adult is the caregiver. They're providing childcare for somebody or for a spouse. Access to cell phone, some questions around nutrition, sedentary lifestyle, self-medication. What else do you take to feel good, to try to get to that? I mentioned a little bit of a PSA on delirium and what to watch for, and then to have a QR code on the back that makes it easier for people wanted to find this or learn more about it. We have this really tiny, if I go back in the slides, like this little itty bitty URL at the bottom, and that was too small. So to do a QR code for people, there is a group that is made. We have some banners that health systems are using, or those little like roll up things that you can bring to a meeting, and it has the 4Ms and a QR code for people as well. But it's been really neat to see how people are using this. I want to pause for a moment and just see if there's any questions in the chat.
I don't see any questions.
I don't see them. Okay. So then what I want to share with you a little bit more is work that we've been doing to reach health systems and to learn what their interests may be. So we've been doing some work with AARP. They've helped fund some of this work for us to learn. We set up a community of practice where we had 8 questions to work with health systems who are willing to get really nitty-gritty with us. They didn't have to have all the answers. They weren't trying to implement this in a really formal way, but we wanted to learn what it is that would make it easier for our health system to distribute this guide. How do the older adults in their community want to receive it? Who might pay for printing in the future? How do you train clinicians on this? We just had some learning questions. And so we started to work with 12 health systems that were around the country who agreed, yes, we'd love to be a part of that. All we were able to offer is we'll pay to print the guide. I should have mentioned this is totally free as a PDF and as a tool that you can download or to include in a MyChart. The only cost is incurred when going to print it, and we don't make money off of that. We provide a site if you want to order shipping, but we also give you the file and the printing specs if you've got a local UPS store or your health system offers printing. But we said, we'll give you some guides if you're willing to go test this out for us. And I apologize in advance that there's not a Hawaii site on here. One of our main faculty people who works on this is a State Department family and is based in Cairo, Egypt. So she's another 6 hours off from us. And so with Hawaii and Alaska, we just found that we couldn't make the time zones work for this. It was just kind of a quick little, this community of practice. And so one of the things that we started to learn is where and how older adults would like to receive this guide. So there's a lot of things that might happen within the health system. I saw that we had somebody from Meals on Wheels on the call today. People talked about that, working with different faith leaders, libraries, the state AARP office, different senior centers. Some people talked about maybe a distribution system, the way COVID tests were done, like come get your free guide here. Here's a place where we can get it, or call this number and we'll send you 2 guides. So there were just a lot of really creative ideas of what people came up with. What was important to hear from individuals is that while a lot of folks were interested in doing the online portals and having it be a part of the EMR with, you could go and you talk to your doctor and you can attach a digital version. That worked for some. Not everybody was feeling as tech savvy or kind of have different abilities to absorb that. And that can change quickly. That can kind of be different for different people. But not everybody has computers or internet, and that paper was king. That was the phrase that we heard from somebody, and it kept being reiterated by others. People really like having this and being able to kind of pen to paper, take it with me, bring it to an appointment, and not worry about a digital version. I'd be interested if you end up with similar types of feedback on your programs, or if people have really moved to a fully digital situation. And then we started to learn how providers might use this across the system, starting with personally, like taking off the professional hat, whether you have an older adult in your life, are an older adult, have a neighbor. It's a great way to say, can we go through this? It makes it much more authentic when talking with a patient of, I just did this with my parent, or I just went through the guide myself. Sharing it with the staff internally. We've seen a real interest from age-friendly health systems who are already working on age-friendly to do this with medical students, nursing students, pharmacy students, any new hires coming into the facility who they want to introduce the 4Ms to. This tool has been so much easier because it's written in lay terms, and it really gets to like, oh, I get it now. I understand why we would be asking these questions. I can see clinically what we might do with that information, but I understand why it's presented in this way. Some folks doing it just as new hire orientation, even if it's somebody who's very senior in their role, but as an introduction, here's what we have for everybody who's working within this health system as part of our orientation. And then thinking about the ways to go kind of direct to older adults, how to hand out those hard copies or send them a link to a guide. So we've seen groups that are doing inpatient, like hard copies that are in the discharge packets, or if you're being prepared for your next appointment, that could even be from the ED, or if somebody was inpatient. We've now set up your appointment with your PCP for Thursday. Please take a look at this, go through it, and be prepared for that appointment. In outpatient settings, kind of incorporating, I feel like the annual Medicare wellness visit, a lot of people are trying to put a lot of things into that appointment, but is it something that could either be handed out at that or sent to somebody ahead of time? Maybe it's a specialist office upon a new diagnosis. We really see it being helpful for any kind of clinical interaction. Going to my ophthalmologist, going to my orthopedist, because what matters most to me is dancing at my son's wedding in 3 months, and my knee's really been hurting, and I want to work on that, or I've got a trip planned, or I'm worried about the surgery that I'm going to be having. In the long-term care settings, kind of somebody living with a serious illness maybe needs help with things as part of onboarding, or somebody immediately upon admission or kind of welcoming to a new community. This is something we do with everybody. So there's a lot of ways that it kind of goes directly to the older adults. The electronic communications can be helpful. Jeanette, you were talking about the newsletter is the best way to find out what's been going on with us lately. Incorporating something like this into a newsletter or mailer, putting it into the patient portal is still a great option. And then some of the co-hosting of days directly in the community outside the 4 walls of a healthcare institution. Are there groups that are doing What Matters to You Day or National Healthcare Decisions Day, or a program that the chaplains are doing as an interfaith network? So a lot of groups could do things that way. There's no wrong way to introduce it. It really just depends on who you want to reach and what your goal is for doing that. I'm pausing because I see that there's one comment that's come in. If the IDT teams for palliative care would appreciate this. Does anybody else have thoughts on that?
How you doing, Kate? This is James. I was the one that posted that comment. Only reason I mentioned it is because I know you don't have a spot here in Hawaii for palliative care. We offer this benefit where we're trying to incorporate interdisciplinary teams to a little bit clearer and a little bit more caring, holistically treating the patient and the symptoms with information on what's going on with them as far as their palliative care. They may not be quite at hospice or don't want to be inside of those like long-term care facilities, but still communication with the patient and the providers and the health plans about what benefits are available is what they're doing. I was wondering if the IDT teams, along with what they're doing, may appreciate that in the communication with the patient and the providers.
Yeah. I think that sounds great. And I should clarify that while we didn't, in this kind of small funded project that AARP did, we didn't have a Hawaii site, but I've just pulled up a list of Hawaii groups in the age-friendly movement, and I see dozens within Hawaii. So it has been out now, so there may be some people who are using it, but I love the idea of including it for that interdisciplinary team, especially if there's handoffs that are happening or somebody's being moved around. Can this be some of the language? I've heard from a colleague who went on to medical school who's like, these 4Ms have made it so easy for me to do just a quick checklist in my head of have we talked about these 4 things. When we originally came up with others, the age-friendly health system movement, we knew we wanted to work on serving older adults, and did a scan of all best practices in clinical care. There was something like 97 possible interventions that could have been worth working on. And as they started to sort them, they realized most of those fell into these 4Ms. So you heard like depression, delirium, dementia, that fits within the mentation or the mind category. There's a lot of stuff that could be under medications. Is it deprescribing? Is it making sure that we're not, causing something that then causes a mobility problem because somebody's too dizzy and they aren't able to get up and walk around? So they really interact with each other very well. And I think for students in particular, it's helped them feel more confident interacting with an older adult and just having that little checklist. I'm happy to hear for Joyce that the 4Ms have been helpful for them as well. I loved this quote that we have from one of the participants. So Sutter Health is a big health system on the West Coast. Carrie Maya is one of our participants, and she has done a lot of work with Age Friendly. We're working on big collaboratives, 18 months and lots of travel. And she was like, this, my health checklist piece has been one of my most favorite parts on Age Friendly. And she is in charge of professional development within the whole system. That's kind of her area. So she was really thinking about that orientation, onboarding. And she has moved so fast with this that they're now going to try to have it be part of every single admission within the Sutter system in all different types of settings that they have. And she just had this great quote that we've had physicians, social workers, nurses, chaplains, all of these people getting involved in these conversations and finding it to be a useful tool. It's creating a lot of momentum around not just the My Health Checklist, but how we can improve care for older individuals as well. So it seems to be like the galvanizing tool that we can all work around. I should mention that there's a way to co-brand it as well with another organization's logo on the front if you want to have your organization listed there. So we've been working on creating some materials. These are the ones we've been working on. They haven't been posted yet, but they will be, of part of what I've just done for you. Like, what are some frequently asked questions about it? How to introduce this to different healthcare teams, how to introduce it to older adults, how to introduce it to community groups. We now have a couple of videos from some of our participants talking about how they've done it. Carrie is an example. And then there's a group at University of Maryland who's really incorporated this into their pharmacy program. So that's been an interesting one to see. And it has been interesting to get the feedback on how to get this printed. There are some groups who say, I've got no budget whatsoever, or my area agency on aging has a great budget for this. That's who I would go to in my community. Or the local payer, a health plan that's nearby who says, yes, we would be happy to provide these. We send out mailers for people about their back pain or about other issues. What if we send this out to people, or we provide copies within your health system? I heard one person who said, I don't have a budget for printing, but I do have a really healthy printing budget whenever we have a conference. And so I've just learned to overprint all these guides, and whoops, I happen to have 200 extras. Like, look at that. We didn't use them all up at the conference because that was the easiest way to get it into, Jeanette, I was joking with you about your budget for lays. Sometimes it's harder to mess with what the budget is, but you can find where the funds might be. And I would love if there's conversation here about what you guys recommend there. We also have some other resources. So we've talked about the Conversation Project resources. We have a What Matters to Me guide for people living with serious illness. It's not a, it never mentions death or dying. And I should note that this 4M's guide does not do advanced care planning in the traditional way. It's not talking about healthcare proxies. We tell people if you have more questions about that, go check out this website, and the Conversation Project resources are on that website. But so we still have a lot of our Conversation Project resources. We have been very careful that What Matters may include advanced care planning, but it is not exclusively about advanced care planning. For older adults, there's a lot of other things that matter than just that. And then we have a tool for clinicians on how to ask what matters. And that may sound a little bit silly, but it's one of the things that we heard from people of, I get the concept and I still don't know what words to use, like how to feel natural in the way to bring this up with a patient in an appointment, to like, what matters to you feels a little bit vague. The concept makes sense, but what are the actual terms to use or how to get comfortable doing that? We have a lot of great tips on that. And so I thought I would close with this quote that is a perennial favorite of mine, that the new hope is that we can change the culture to treat the patients as they wish to be treated rather than treating them because we can. And that to me feels like a whole part of why we are doing this part. So I will pause there. I included my email here, and I will also put it in the chat if people want to copy and paste in case there's any kind of questions that come up. But now I'm going to stop sharing.
Kate, thank you for
Yeah.
coming and sharing your wisdom